theme of your conference, Reimagining Health System, Green, Agile and Citizen-Centered, was very well chosen, and it hits the nail right on the head.
Citizens are willing to share health data, but of course with certain safeguards. So they want to know that it's safe, it's secure.
People, what is their experience? And in fact, it was very clear. It's that it's overwhelming. Over 98% of them want to collect the data about their health, want to share it, and to share it for research and healthcare purpose, not only for their benefit, but for the benefit of all the people affected by their rare disease, or even broader by the society.
Data, I think this will continue to be the big debate for many reasons. We are moving from this my data to the ours data. So I think what was said about the future, we continue to have very interesting questions about the implementation of hopefully agreed European health data space. This is a huge effort ahead of us.
And that is the technology of AI. AI leverages these algorithms to bring together different data sets, from health data to environmental data to societal data, all together to predict what is the best outcome.
I have to say that from the company perspective, the patient role and the patient voice is also important in terms of driving innovation. This is an absolutely incredible source of not just inspiration for companies, but perspectives, insights and data that the companies work on to advance their innovation.
Thank you so much. I'm delighted to be here. And I guess there's two starting points. One is that climate change is a health issue. It's inherently about our health. It's not just about the environment. We can't have healthy people on an unhealthy planet. So the quicker we realise that this is a health issue and therefore should be integrated into everything we do in healthcare, the better.
We know that life expectancy goes up 1 year every 4 years. So we have a huge population emerging of older people who are healthier than their cohorts of 5 years ago, 10 years ago, but the population of 85-year-olds will still be huge consumers of healthcare. They do not want to be in hospital. All the evidence is that's bad for the outcomes. So therefore, what are the greener models of healthcare that support people to be at home?
Aging is inevitable, but healthy aging requires us also to invest very much in prevention and in ensuring that people can have access to all those factors which we know will enable them to age more.
The question that we need to be asking ourselves, Tamsin, is where do we invest? Do we invest in compressing morbidity or extending life expectancy? And it's an obvious answer. We need to compress morbidity, because if we actually invested in health promotion, prevention, non-communicable diseases, then in fact that would give us a social and economic benefit far beyond increasing life expectancy.
The importance of the non-communicable disease approaches is that there are many medicines that have proven to be cost-effective in managing at the secondary prevention level cardiovascular disease, diabetes, chronic kidney disease. So I think it's the importance of trying to blend in secondary prevention approaches, of course, which primary care gives, but also trying to help engage people in their own health.
We cut that wasting and invest in innovative technologies. Technologies that are able to A, improve health outcomes, which means individually and collectively, make elderly people or senior society more independent, better contributor to society, taking them out from the hospital faster but better, and third, which is even more important, increase the level of the population health.
This is a pivotal time for establishing EU support for health system with a new multi-annual financial framework and a post-pandemic policy orientation emerging.
I think a couple of reasons are not only this speech, but obviously COVID. COVID, I think, showed to everybody how important the care sector is, how fragile the care sector is, and that actually is true for the whole, also for health. I think it was an eye-opener. Not new in a way, because those people who read the analysis knew where the weaknesses are, but of course we saw it very, very clearly. That was definitely an eye-opener. I think also member states' preparedness to think about EU-wide solutions grew a lot. In that they saw that these are not issues that can be solved easily in a member state only, in an area which is obviously much more reserved for member state competence.